Welcome to Cycle of an Imaging Procedure. Through viewing this video, you should be able to identify who may order an imaging procedure, describe the steps within the cycle of an imaging procedure, define the acronyms HIS, RIS, and PACS, and discuss the technologist's role in the cycle of an imaging procedure. It starts with a patient visiting a healthcare provider with a medical issue. When the patient goes to the provider will evaluate the patient and determine if an imaging procedure is necessary. The healthcare provider then determines the need for an imaging procedure and writes the order. Healthcare providers that may order imaging examinations include medical physicians, physician's assistants, nurse practitioners, and chiropractic physicians. The patient takes the order to the hospital and registers within the Hospital Information System. The purpose of the Hospital Information System, or HIS, is to manage the information that health professionals need to perform their jobs effectively and efficiently. The HIS houses patient demographics, insurance and billing information, and other core systems to communicate throughout the hospital system. The patient then presents to the radiology department and is entered into the Radiology Information System, or RIS. The RIS is specific to imaging, but also houses patient demographics. It is a record of all of the patient visits to the imaging department. This is where the healthcare practitioner's order is entered into the RIS. From here, the RIS generates a procedure request, and the patient is added to the modality work list. A work list is an electronic list of all the patients that are waiting for procedures to take place. From here, the technologist can select the patient's name and perform the exam underneath the patient's name so that the images are associated with that specific patient. The work list and the printing of the requisition or request is an indication to the technologist that a patient is waiting for an exam. The technologist must ensure that all the paperwork matches and the patient information is true and correct. The technologist may now retrieve the patient from the waiting area and bring them to the exam room. The technologist will then verify the patient's information by verifying the patient's name and other patient identifiers and take a complete patient history that will be relayed to the radiologist later on. The history will include all signs and symptoms that the patient presents with that are related to the imaging procedure they are having. After the technologist has received all the necessary information, he or she will explain the exam and perform the procedure on the patient as prescribed. The technologist will then process the images if necessary and perform any post-processing procedures. The technologist will then complete any necessary paperwork and/or data entries into the RIS. The procedure is not complete until the technologist tells the RIS it is complete, and this is often done by making an entry in the computer system. The technologist then reviews images and checks for quality and sends the images to PACS, or the Picture Archiving and Communication System. The PACS digitally stores and transmits electronic images and associated information via a secure network system. Once all of the information is received into the PACS and RIS, the radiologist views the imaging procedure. The radiologist systematically views all the available images for pathologies and abnormalities. He states or dictates his findings out loud into a microphone. These dictated findings create the imaging report. The reports are very complex and filled with medical terminology. The recording is either typed into a written report by a transcriptionist at a later date, or a voice recognition software system transcribes the report as the radiologist is speaking. Voice recognition, or VR, is a newer technology but is quite commonplace in imaging. The finished report is reviewed for accuracy by the radiologist and then signed off with his approval. The imaging report is sent to the ordering healthcare practitioner through the RIS, the HIS, via fax, verbal report, or even email. The ordering physician reviews the report and determines a course of action. The results may be relayed to the patient over the phone or during an office appointment. From there, the patient is notified of any actions or precautions that need to be taken. Once the patient has been given the results, this concludes the cycle of an imaging procedure, from practitioner order to patient result.